For Amelia DeVries, everything changed in 24 hours.
She never really had any health problems. She was happy, full of energy. And then one night, Brian went to put her in the bathtub and took off her shirt, and there was this lump, like a large lump, sticking out the side of her abdomen, and it seemingly showed up overnight.
They called a friend who worked at CHEO who advised them to rush their only child to the Children's Hospital of Eastern Ontario.
She said, come right here, which is good.
This is what they found.
This is tumor, yeah. This whole tumor.
A massive tumor for a 2-year-old. After many tests, it was determined it was one of the most vicious childhood cancers, neuroblastoma.
The original tumor itself was 12 centimeters by 12 centimeters by 13 centimeters, which for a 2-year-old is basically her whole abdomen. Like, that's a big tumor. It had spread to her bones, her arms and her legs, I think her pelvis, her bone marrow, a few spots in the tissue near her spine.
While terrifying, doctors around the world in partnership with CHEO have made incredible advances in fighting this type of cancer.
The big advancement is we have this chimeric antibody therapy. So that it was a study that they originally did comparing chimeric antibody to a drug called retinoic acid. And they actually had to stop the study midway through because it increased the survival by 20%, which doesn't happen in cancer, in pediatric oncology, let alone oncology. So it's a huge, huge advancement.
Previously, neuroblastoma had a survival rate of just 20 to 30%. Now it's about 70%. But it's still hard to defeat, and it's best to get it the first time around.
If neuroblastoma relapses, it's very, very challenging to treat, and it's very hard to treat with curative intent. There are some kids that will survive, have relapsed neuroblastoma, but it's really, really challenging.
They said in our meeting, if this had been 10, 15 years ago, we would be having a very different conversation.
But that means Amelia needs aggressive chemotherapy to reduce the size of the tumor. And then she will need a stem cell transplant. It's very hard for a 2-year-old. Really, really hard.
Wow, you're brave.
You want a sticker?
Carol.
It eats you up inside. It's hard.
Can we lay down for 1 second?
Can you lie back for a second?
Please?
Just for 2 seconds.
And now the chemotherapy is in. But so nerve-wracking for her parents, who know they need to see a difference in the size of the tumor to move to the next stage to save her. Remember, this was before. And this is the result.
This is the tumor after chemotherapy. More than 70% to 80% decrease in the size.
Well, that's good news. It means now surgeons will need to remove the huge tumor, and that's going to be difficult, as it's so invasive.
We are at the point where we feel it's safe to go ahead and do an incision in the abdomen and hopefully take out the tumor completely without, of course, injuring other organs in the abdomen. So we have to be very careful today in taking it out without injuring other structures.
The tumor is close to her kidneys, spleen, stomach, and pancreas.
We'll take good care of her, we promise.
The surgery takes about 3 hours, and they get almost all of the tumor. The rest of it is too close to organs and will have to be killed with chemotherapy. Just a week later, and Amelia is home and playing with her dog and her cat.
You!
Except for the still required feeding tube, life looks pretty normal in this country home just outside of Ottawa. But Amelia's parents know the battle is not over. Soon, Amelia will need a stem cell transplant. Another ordeal.
You have to think positive, and even in the hard times, you have to stay positive and get through it. It's still going to be a long road after this, but this will be another step in their journey.